One of the features we have here at Excellence Advisory Group is our Tuesday morning coffee session. And so we're going to tag that on to today's webinar. And I have a colleague with me, Loie, who's going to help us understand some of the more diverse questions in regards to the emerging infectious diseases that Medicare has asked us to address at our surgery centers. So thanks, Loie, for joining us.
Well, thank you for having me.
I appreciate it. Loie comes from one of the biggest employers here in St. Louis, Barnes Hospital. She's a CIC, which is a certified infection preventionist at the hospital, and covers many areas, but most importantly to us today is her experience in the ambulatory surgery center world. And so what I wanted to ask her was, first and foremost, I know we're all really concerned that we've been hearing that the CDC is asking folks to wear the masks if they're protecting, if they're infected and they're not wanting to spread the disease. But yet what we're seeing is everybody and their brother wearing masks out there. So we know that these folks aren't all infected. So give me your 2 cents on that.
Well, I think that one of the reasons that people wear these masks is I think it gives them a false sense of security. The CDC recommendation, as well as the World Health Organization, says you should wear a mask if you're caring for a suspected patient. If you're a suspected patient and you're interacting with people, you should wear one as well. But the biggest problem with the mask that everybody and their brother is wearing is, first of all, they're probably not donning and doffing them appropriately.
Right.
They're not disposing of them appropriately. And I've seen many times they'll have the mask on, but they'll have their nose coming out.
Exposed. Mm-hmm.
So what's the point?
Right.
To properly put them on and take them off, you need to only handle that. Wash your hands before you put it on. Wash your hands before you take it off. Only handle the straps behind the ears. Make sure you dispose of it in a place where nobody can get to it. And then, of course, do hand hygiene again. But one of the things we need to think about with these masks is what exactly is the purpose of these masks? And when they wear these masks, and they don't wear these in surgery, but we'll make the assumption they're not worn as a filter for the people in the surgical procedure, but they're worn as a barrier to keep the germs from those people who are performing the surgery from getting into the sterile field.
Got it. Okay.
So when I'm wearing a mask, it may filter some, but if I have it on for any length of time, it's going to get wet from the humidity that I breathe in and out, and then they're not nearly as effective anymore. So they need to be changed frequently. And again, they're not necessarily a filter unless you're wearing an N95. They're more of a barrier. So that's why it's more important for these suspected patients to wear them rather than everybody and their brother. That being said, in China, I think some people just wear masks all the time, every day.
Mm-hmm, mm-hmm. It's a thing.
I went to Malaysia a couple years ago, and when I got to Hong Kong, they were all wearing masks. When I was in Tokyo, they were all wearing masks. And I'm like,
so did you put one on?
No. I'm like, is there an epidemic going on that I don't know about? Well, I'm going to take my chances, and I didn't get sick, so I guess it was okay. But I think that's just sort of, since SARS way back when, they have this fear, so they wear masks all the time.
Got it.
I couldn't do that.
Right. Okay. So I think that answers the question. Infected, you don't necessarily need to have one on, and all these folks are just overkill, I guess, at this point.
Exactly.
So along with that, because everyone's wearing them, we're starting to recognize shortages, not necessarily because of the overpopulation of wearing them, but also the folks that are manufacturing them are on house arrest or restricted. They live in China and they've been told to stay home. Mm-hmm. So what are we supposed to do for our surgery centers when we can't get masks? Because people are starting to tell me that.
And I understand it certainly would be a problem. But again, we had discussed if cloth masks were okay and to put them through the sterilizer. But when we think about it, the masks that we wear in surgery aren't sterile.
Good point by you.
So I think cloth masks would be acceptable. Again, we're looking for that barrier, but they should be clean. And certainly my recommendation would be that they be made out of white cotton and bleached, because I love bleach.
Sure.
It's good for anything. And then dried on a high heat in the dryer. But again, those are probably more likely to pick up moisture than the yellow paper ones. So we certainly couldn't have a mask and wear it all day. They would have to be changed frequently, certainly a new one for every case you go into.
Got it, okay.
But that's the way it should be anyway. You shouldn't
Right.
wear the same mask all day anyway.
Right, right.
And I know there are surveyors looking that if you come out of the OR with that mask on,
It's gotta go.
It's got to go, and then you put a new one on to go in.
Got
But
it.
I don't know that these masks would need to be sterile because the ones we're using now aren't.
I see. Good point, good point. Now, by the same token, what if we start, and I haven't heard of this, so I'm just saying, what if we start seeing a shortage of gowns to wear in the OR? Because again, they're coming from China as well.
Right, and that is a problem, and we actually were notified of a gown shortage before COVID-19 made its debut. They started off, they were concerned about the gowns in our sterile packs, like our central line
Right,
kits and things like that. They could not guarantee the sterility of those. So there was a lot of scrambling that went on. Fortunately, being a large healthcare system, we have a lot of clout in the supply world.
Yes, you do.
And we have people that actually, that is their job, just to deal with supply issues like that. So they went to other suppliers to make sure that we would have enough. We also have more than a 1 or 2 day supply of them as well. So we weren't really concerned. But one of the things to think about is, yes, you need to wear gowns, and the problem is they're not being made fast enough. And certainly you can't wear the same gown case to case.
Right.
We don't want to go back to the 1800s. But that is a problem, and you just have to find a way to get the gowns. Somebody out there is going to pick up on this and say, you know what, if I start making sterile gowns,
Yeah, I can do this.
I can do this, and how many can I sell? Oh, a lot in a heartbeat.
Amazon.
They probably have them on Amazon, and
Yeah.
but they probably come from China, so I don't know.
Yeah, we'll see, we'll see. Okay, so I think most of our centers are doing a pretty good job of reviewing with patients before they come in, where they've been, how they've traveled, yada, yada, during the pre-op. You're from a big organization. How do you manage the same concept for visitors? Because we all have to have drivers for our patients.
Right.
But we're not interviewing them during the pre-op phone call.
Well, that is a problem. Again, and in our outpatient surgery centers, we again screen the patients beforehand. And I think if you have a patient that is positive for that travel history, that kind of would put up a red flag that maybe you need to investigate a little further, because chances are they didn't come back, didn't go there alone.
Right.
But for our inpatients and all of our other centers, and we do have signs up that were recommended by the CDC, great big 18 by 24 signs in multiple languages that say, you know, if you have this travel history and you're having these kind of symptoms, please let the first person you talk to know so that they can give you a mask and seat you away from the rest of the patients.
So you have these in your waiting room?
Yes.
Awesome. Okay, good idea. Good to know, good to know. Okay, all right.
We have them, there. We probably have, oh, I don't know. There's even one for coming in from the employee garage, which I'm
Yikes.
not quite sure why it's there, but
There
okay.
there you go. Well, you have a lot of employees, and
Yes,
maybe they're traveling,
this is
so.
true.
All right, so early on, and we talked about this earlier in the web, CDC made a pretty bold statement that at this point in time, they are unsure if contaminants that are on a surface, and then you touch that and you go to your nose or your mouth, can contaminate you. Typically, it's droplets. Have you seen or heard anything more about that concept?
No, but to that extent, if you're sneezing,
Right?
we all know how far those droplets
Yes,
can
we do.
carry. And were they to touch a surface, I don't know how long the coronavirus can sustain on an environmental surface. Most viruses like that can't sustain more than 24 hours. I'm going to assume, for the sake of argument, that corona is along those lines. So it would seem logical to me that you could touch that and then rub your eye and rub your nose and make you sick, which is why, again, which will probably be engraved on my tombstone, wash your hands.
There you go. There you go. Coming from a big organization such as you do with Barnes, have you had any of these patients?
No.
Or no?
No.
No.
No,
Okay.
we have, again, we very, I'm not sure the word I'm looking for here. Anyway, we have a policy to deal with situations like this. It started when SARS came into the forefront, and then when Ebola hit, it really strengthened our policy, and so much so that we had an actual suspected MERS patient come in, and we followed the policy, all of our directions, and everything worked fine. And because our hospital is the only Ebola stabilization and transport hospital in the state, we drill frequently.
Congrats.
Not sure about that or not, but anyway, we drill frequently on how to handle these patients, how to get them from the emergency room to the intensive care unit, from the intensive care unit to the ambulance, how to get them from the emergency room to the airport when they're stable enough to go to the national hospitals in either Iowa or Nebraska. So that, when we had this suspected MERS patient, which turned out not to be, everybody was okay with all of the restrictions that we put in place, and nobody was freaked out by it, which really surprised me.
Good.
So,
good.
that just shows that when you practice this stuff frequently, people become accustomed to it and are like, okay.
There you go. There you go. Now, what we tell most of our surgery centers are, if you have a concern, a suspect, we isolate them, and, we're tiny surgery centers.
Right.
We don't have many places. It's likely a bathroom. We just put them in there, close the door, and call Department of Health. Good?
Well, bathroom's got a fan, so it's going to be exhausting.
Got a pull cord.
You've got negative pressure in there.
Yeah.
So that's good. And, that's probably the best place you can do if you don't have any place else to do that. And I don't think that's unreasonable. I'm sure the patient doesn't like it, but if
They should have fessed up during their pre-op phone call.
Exactly.
Yikes.
Exactly. That's what I was just going to say. And that's why that pre-op phone call is so important.
Well, and that is because there are a lot of pain centers and a lot of GI centers, because of the volume and what they do, they don't do the pre-op phone call. So I think this is going to take on a new life just as we speak.
And if they don't do the pre-op phone call, then they need to have that information in their waiting rooms that hits you in the face as soon as you come in.
Right.
If you can answer this or whatever the sign says, you need to let them know immediately and put on a mask.
Yeah, I like that. Yeah, that's a good idea. That's a good idea. So talk to me a little bit about the test kits for coronavirus. Do you have them at your facility?
We do not. If we were to receive a suspected patient, it would have to go to the state health department for testing.
Okay, so they're still very limited.
Yes, very limited.
Okay, I know there's been some issues with them, and they're working through some bugs, but, hopefully that's all good. Thoughts on vaccines for this virus?
The coronavirus, I saw something the other day that somebody was looking at a can of Lysol and it said coronavirus on it. And they're like, how can they say this is new? It's been around for years, which is very true. But this is a new, just like influenza, this virus morphs and changes. So they probably could come up for a vaccine for the COVID-19, but that might not be what we see next. It may shift and drift into something else, and it may provide some protection. It may not. But we've seen, it's the same type of virus that SARS and MERS both were.
Same family.
But they have changed the name of it because they were all novel coronaviruses. But they've changed it so that it's not the name's not associated with a particular place in the country. So it's not associated.
So it's not China?
Well, they didn't want to call it the Wuhan virus. But like SARS is Southern Asia. Right. MERS was Middle Eastern. Well, they don't want that to be part of the name anymore, which is why they came up with the name of COVID-19. COVID was for coronavirus infectious disease, and 19 because it was in 2019 that it first came up, like December 31st. Happy New Year.
Yeah, there you go. Yikes. So it's a possibility.
It is a possibility, but again, I don't know that that's something that maybe in China, because obviously they have a lot of trouble with this. This is not the first incidents they had. But if we look at influenza, and this is a personal campaign, influenza is something, single most vaccine preventable death in the United States every year. Even if there was, even if there was a vaccine for coronavirus, I don't know if people would get it or not. In this current flu season, we've seen 29 million influenza cases. There have been 280,000 hospitalizations and 16,000 deaths, including 105 children.
Wow.
Compared to the stats we're seeing for COVID-19,
doesn't match up.
No, and I wish people would get this worried about it. And My husband always asks me, well, what about this coronavirus? I said, it's like influenza. It really isn't that much different. People die of flu, especially the younger ones, the people with comorbidities. This seems to be the same kind of thing. But people have heard about flu every year for however long they've been around. They don't think it's that big of a deal. And it's very similar to flu. It's a virus that you can get there. I don't know if antivirals actually do anything or not, or if they just give you palliative care till you get better. There are antivirals to treat the flu, but you have to go in and be tested first. And most people, a lot of people do that, but a lot of people don't.
Right.
So, it's hard to say. But I think, again, before we get worried about this coronavirus, because they got a pretty tight leash on it right now, I think people need to be worried about influenza as well, and especially in your ambulatory surgery centers. If you have somebody coming in and they tell you when you do that pre-op call that they have a fever, what are you going to tell them?
No.
No, exactly.
Next week.
Yeah,
Well, next month.
Yeah.
Forget the MPO stuff.
Yeah. Just go ahead, drink lots of fluid, stay in bed, and we'll see you sometime in the future. And again, most of these centers, their procedures are elective.
Right.
It's
It's
not
not a
like-
deal breaker. We don't have to do it today,
Exactly.
other than our doctors wanting us to do it
Well,
today.
then there's that. But, we're not going there right now. I think, good communication, they need to have a good policy in place. And one of the things that needs to be in place that employees really need to be aware of is if you're sick,
Stay home. Yikes. I
Yes.
get it. I get it.
I've seen it go through clinics. I've seen it go through surgery centers. One person brings it home from their kid, they bring it into work,
Right,
and then the
right.
next month, everybody in there's sick. And
Yeah.
you're not doing anybody any favors by coming
Right,
to work sick.
right.
You're not doing your patients any favors by coming to work sick.
Exactly. Well, I really appreciate your thoughts. Anything else you can think of that our surgery centers specifically need to be considering?
I think one of the things that for the surgery centers is to have, and what worked for us because I guess it was with MERS and also with Ebola, we had a policy regarding the screening when somebody's calling in for an appointment to a clinic, when they're calling the emergency room, when they come into the emergency room or wherever they show up. And we have that, it's automatically in the computer and we can turn it on and off. So as soon as this started being an issue, we turned that back on.
Got it.
And I know that sometimes it's like, you ask these same questions 5,000 times a day, but when you're in a situation like this, it's really important to know what you're dealing with. You don't want your patient showing up pale with 102 fever, coughing and hacking all over everything.
Right.
Whether it's influenza, COVID-19, or whatever.
Yeah.
They need to not be there, and you need to know that going in.
Okay. All right. Well, we'll definitely put our best face forward here and try
Yeah.
to get this in line. So, well, I appreciate you doing this for us today.
Thank you. It
I
was
think it's
fun.
awesome, and we'll follow up with any questions that anybody might have on the call today.
great.
And Loie's going to be available, via email to me if we have something very specific to your particular center. So, thanks so much again for attending today.
Thank you.
Bye now.
Bye.